नमस्कार. अलर्ट, ॲक्टिव्ह अँड अलाइव्ह ॲट 100 ह्या कार्यावळीत तुमचे स्वागत. डेम्पो हेल्थ केअर प्रस्तुत ही कार्यावळ आम्ही स्वर्गीय श्री विश्वासराव डेम्पो यांच्या यादीन राबयतात. दर शुक्रारा रातचे 10 वरांचेर प्रुडंट मिडियाचेर आम्ही येतात तुमच्या बरोबर आरोग्य, स्वास्थ्य आणि आपल्या भलायकीचे विषय घेऊन तुमच्याशी चर्चा करपाक. आमच्या बरोबर आसात डॉक्टर दिगंबर नाईक. नमस्कार डॉक्टर. Welcome to the show. Dr. Naik is a renowned heart specialist from Goa and his name has already been recognized as one of the 50 pathfinders of the Indian healthcare industry. The book that is written by Dr. Naik, Alert, Active and Alive at 100, या पुस्तकाचेर आधारित ही कार्यावळ आसा आणि त्या पुस्तकान बरयले वेगवेगळे विषय त्याबद्दलची चर्चा आम्ही ह्या प्रत्येक एपिसोडान करतात, तुमच्याशी डिस्कस करतात आणि तुमच्याकडून आयल्या प्रश्नांची उत्तरां आम्ही ह्या एपिसोडान प्रत्येक एपिसोडान आम्ही त्या उत्तरां सोदतात, ताची चर्चा करतात. दर विकान आमच्याकडे वेगवेगळ्या विशयाचेर वेगवेगळे प्रश्न आयिल्ले आसात. पण ह्या खेपे जो प्रश्न आयिल्लो आसा तो एका जाणट्या बायलेचो, हू सेज की पयलींच्या काळान जेन्ना वेन शी वॉज अ चायल्ड, मे बी 15-16 years, तेन्ना एपेंडिक्सची ऑपरेशन्स खूप जाताली. तांकां एपेंडिसायटीस जातालो आणि तिचे बरीचशी भावंडां, तिचो भाव म्हणा, तिचो पूत म्हणा, हांकां एपेंडिसायटीस जाल्लो आसा आणि द एपेंडिक्स हॅज ऑलरेडी बीन रिमूव्ड. नाव हर क्वेरी इज व्हेरी इंटरेस्टिंग. ती कितें म्हणटा की आतां जी तिचे नातू बी आसात तांकां हो प्रॉब्लेम कसो काय जावंक ना, बिकॉज वॉट शी वॉज एंटिसिपेटींग इज की आपल्याक जालो म्हणजे तांकां हो जातलो, बिकॉज इट्स द सेम डायट दॅट दे आर फॉलोईंग. तर तिचो प्रश्न असो आसा की आमचे सगळ्यांचे काडिल्ले आसा, एपेंडिसेक्टोमी जाल्ली आसा, पण आमची जी भुरगीं आतां घरांतली आसात, नातू म्हणा पण अँड द अदर सिबलिंग्स, तांकां हो प्रॉब्लेम कसो जायना किंवा कित्याक जालो ना. So I think the question is very interesting. तिका वो प्रश्न पडलो कारण she had already gone through it. So I want you to tell us like what has changed that these children have been saved from this ailment.
Okay, I think this is the most interesting question. Okay, if you look at this question, I would open out our medical care in more than 5-fold. One aspect is making a diagnosis.
Right.
Second aspect, the way we have learned to live our life today. The way the families have learned to live our life today. The way we look at our disease today. And many more answers get open. Let's look at the पहिलेच आम्ही diagnostic एका पोया. That time when I was a medical student, just joined as a medical student, I remember every day 5-10 surgeries of acute appendicitis. What was happening? आता एक simple machine आमच्याकडे आसा, एक ultrasound. We just talked about echo in the last episode.
Right.
This time I am talking about the same machine. You just put at that time our surgery books were writing big letters, appendix is a magic box. Your abdomen is a magic box. You don't understand what is there inside. You make a diagnosis, go inside, you find something else different. त्यांना आमचे कितें असले एबडॉमिनान कितें जालें की ना ते समजपाक आमचे कडेन very few tests were there, like X-ray, blood test, urine test. Okay, ultrasound machine was not available at that time. Okay, and I mean with all these tests we used to find it very difficult. So I mean आमच्या clinical assessment चे diagnosis करताले.
Right.
And appendicitis was diagnosed as clinically pain on the right side. Okay, right iliac fossa, we used to call it McBurney's point.
Yeah.
And then we used to palpate there, tenderness there, then rebound tenderness munasle,
yes.
then finger tenderness munasle.
Right.
With all these things we used to make, okay, this is appendix, and we used to take the patient for surgery.
And then there was blood test.
Operate the patient, and then after 2-3 days, somehow the patient used to become all right. Okay. Now, when you put a probe, many times everybody comes with abdominal pain.
Right.
Abdominal
and
pain,
for various reasons.
For various reasons. Simple gas, little obstruction, lots of reasons, gastritis,
Right.
hundreds of reasons inside. Okay. Now, most of the time we find that classical pain which you used to get on the right side or even on the left side is commonest these days have been found to be because of a small stone in the kidney.
Right.
That stone tries to go out, gets stuck here at the bladder, and that is where it develops the pain. So most of these diagnoses have been altered. We are able to make a right diagnosis now. We are able to make a right diagnosis if that pain is because of your intestinal colic. We are able to make a right diagnosis because if it is because of urinary infection, that pain also comes in a similar way. I remember during that time when I was student, we went to see one appendicitis, classical pain, and that lady had appendix on the other side. So she had what is called as a situs inversus. So heart was on the right side and on the left side, and
Which is a very rare case.
very rare case. Appendix was on the other side, and we were operating her for appendix. The surgeon is finding the appendix. He goes, then he goes here, makes such a big cut, and finds the appendix here. And of course, he removed the appendix because he said, "Na, falatari jang naka pude." So she was okay. The pain was just because of some stone or some intestinal colic. So पहिली म्हणजे आमची आज diagnosis refined झाला.
Refined झाला, specific झाला.
Specific पोटाचे. I think it's not difficult to make a diagnosis of abdominal pain at all today. It's the simplest diagnosis. So from a magic box, the abdomen has become the very simple box because of just one test called ultrasound. There are thousands of diseases here. Thousands of diseases can be recognized just with your ultrasound specifically. It is this, whether it's an intestinal problem, muscle problem, vascular problem, liver problem, spleen problem, kidney problem, pancreas problem, gallbladder problem. आता कितलेशेच gallstone आम्ही detect करता. Pain is many times on the other side because of the gallstones. And त्यांना आम्ही gallstone म्हणून पुढे detect करपाचे आमचे त्या वेळा खबर सुद्धा नसले. Pancreatitis is a very common sickness today. केन्नाच आम्ही ते diagnose करनासले. It was so difficult. That's why it was called a magic box. The basic thing is, number one, we are able to make a better diagnosis today. So obviously when it is some stone, look at now myasominoela, you go out, come back home, तुझे urine concentrated झाले असता.
बरोबर.
You have not drunk sufficient water, urine concentrated झाले असता. Urinaanसून किती येता? You have phosphate, urate, calcium, oxalate crystals coming out through urine. Say इतल्या volume of urine and there are say 100 crystals. तो volume जेन्ना इल्लोसो जाता तेन्ना हे crystals come close together. And हे crystal are different shapes, so they get entangled into each other. And ते भितर entangled झाले काय ना, this is how you develop a stone.
Right.
And then हळूहळू तो stone वयर जाता, especially now पाऊस पडूंक लागलो की you feel like passing more urine. आणि त्या वेळार ओपीडी वचून पळोवंक जाय, दिसाक दोग-तीग जाण ते क्लासिकल renal colic घेवन येतले. Because the stone tries to come out and the ureter you get that pain. So as पहिली गोष्ट म्हणजे our diagnosis has been improved today, is better today. So we do not get so many appendicitis. दुसरी गोष्ट, yes, dieta विषयी now today we are more refined today.
More conscious.
We are eating more fiber than otherwise. त्या वेळार आमकां कितें खबर आसलें, घरान कितें शिजता ते टेस्टी जाता ते खावपाचे. For us, food at that time was only taste during that time. Now you know that you need fiber, you need all sorts of things, and we are eating a much better diet. Our hygiene is improved. Okay, hygiene in the sense, much bladder, but you go out and pass urine. Then raule, especially girls, for hours together they enter the classroom. Sakafude atang, ghara vachasar they never used to go into a bathroom. Right. Because number one, there were no facility for a bathroom, and they were used to that. And they used to get so many of these complications. Right. I remember one of our elderly professor. We had a professor called Professor Parashar. Very intelligent, brilliant guy, professor of surgery. He do a lot of these appendicitis, and he used to call it as a Goan girl syndrome. GGS. This is GGS. Okay, you operate. He said, unless you operate, she will not feel okay. So don't this operate केले त्यांना appendix operate केले की 8 दिवस हॉस्पिटलान दवरताले. So any painkiller दिले तितल्यान flush केले. Anyway, you used to become all right. So this is the way we used to operate them. So our hygiene has today improved.
Right.
All these girls
Circumstances have
understand keeping your urine in your abdomen for a long time is a problem to your this. Everyone has learned this. On a lot of things that we have learned today, we have refined our life with all these normal routine things. Our exercises, the more you exercise, the better is your circulation, the lesser are all these abdominal problems today. Only problem that we have come along with us, which was not there during this time, is our obesity.
Right.
That is the biggest, I think. Jadisami, we learn to control this obesity. Jadisami, we learn to control this extra weight in us.
I think this current decade, I think we are becoming more conscious about our obesity also.
Are becoming conscious.
So much has been, we are talking so much about diet, we are talking so much about fitness. So I think we are stepping towards a healthier life.
Much healthier life. Today, you find by the time somebody is retired at the age of 60, used to be lying at home at that time.
Right.
Today, he goes out and starts doing another job.
Right.
And is as effective.
Right.
And is as productive. We have seen people who have retired and begun their businesses and grown well into their businesses.
It's never too late.
70, 80, they are absolutely active, and it is absolutely, you have to be absolutely active.
Right.
So up to 100, as I say, you have to be absolutely active. If people,
as you say, alert, active and alive.
Absolutely. If they've at 80, if you find somebody alive is doing a business, at 100 he can easily do it with a little bit of precautions, little bit of carefulness.
बरोबर. तर आमकां ज्या आजीन जो प्रश्न विचारलो त्या प्रश्नाचेर आमी कितले आता डिस्कशन केले. आय थिंक इट लिटरली ओपन्ड अप a new box wherein we found so many answers. आमकां अशें कळून आतां चुकिल्लें आसा with discussion with doctor that circumstances have changed, the age has changed, the time has changed, and we have become more and more specific in the diagnosis. Medical science has advanced so much. So there are so many things why we are not having more cases of appendicitis and why we are having more cases of other ailments. Well, there are so many things that we can discuss on this also, but let us now get back to what we were discussing last episode. I think we discussed about avoiding we were discussing about stress management, and in that we had discussed about avoiding multitasking, and we had a beautiful convenient result that we got. We decided on what to do and what not to do. So let us slow down, and let us slow down our multitasking one thing at a time.
You don't have to slow down. You have to be very accurate. Do 100 things, but one thing at a time.
Right, one thing at a time. Okay, so now another thing that you have mentioned and which I think is important for everybody is you have mentioned about learning to say no.
Yeah.
Like how learning to say no becomes important in a stress-free life. Like how by saying no am I going to, have no stress?
Okay, today our life is so fast pressed. I've got multiple interactions with the society. I'm a doctor, I've got to interact with doctor society. So I have my give and take with the doctors, with the doctor fraternity. I have my demands and I have my fulfillments there. I go into public society, you go in, be a Rotary member, you be a Lions member, you go into some other society. Simultaneously, you are a father or you are a mother at home. You have your interaction, you have your demands from your children, you have your so many things from this. Simultaneously, you have your duties, a number of duties. Even driving today is such a stressful situation.